is Alexandra Burroughs, and in this video we will be talking about patients and technicians working together. So it's a collaborative effort. A lot of people don't know a lot about hospital-acquired infections. That's not something that is, I would consider, general knowledge. I think what people tend to say is that hospitals are dirty. We want to erase that image out of people's head and improve the cleanliness of hospitals, the sterilization methods that are taking place, equipment turnover rates, match volumes with equipment availability, and make sure that we ultimately find a way to eliminate the spread of disease in hospitals, in healthcare facilities, and through communicable disease transmissions, vectors of transmission, and also, in turn, reduce hospital-acquired infections. So, first, I'm going to address how I want the patients to leave, like the impression I want them to leave with. In a previous video, I've talked about what our technicians can offer, but what I want to say is what the takeaway for the patient is going to be. Well, first of all, we'll make a small comparison here. I don't know if you've ever tried to take notes with sticky notes. Unless you're making notes in a book or something like that, these really get lost, or they get the stickiness, adhesiveness of it loses. If it stays on there too long, when you take it off, it tears the paper. So we're going to provide our patients with a little spiral notebook, just like the technicians carry. It fits in your back pocket, so I'll put that in my back pocket. And they'll also be provided a pen as well, okay? So, on their stay. This will allow the patient to take notes on the things that the nurses are telling them. So if the patient is being coached or briefed on diabetes and being prescribed a Novolog Flex Pen for the first time, they will be able to go on ahead and write down what their A1C is. Okay, have an understanding of what it means to have an A1C, what the glucose value represents, what their number represents, and why they're receiving that treatment. They're never going to just have to sit around and wait for a bill in the mail or an email on lab results. We want to get them their lab results as soon as possible and be able to explain to them their numbers and their rates. Because if you're prescribing a Novolog Flex Pen, that means you already got the A1C values. Okay, now of course if there's a situation where we don't know if they have diabetes, we're not going to go around giving people diabetes information, just, you know, inviting that in their life. Okay, this is based on a case-by-case scenario. What we will be informing patients on is why we're coming into their rooms, and they will be made aware that if sterilization methods are not improved or done more frequently within their rooms, with the things that they're accessing, as they're trying to improve and get healthier, as they're trying to get discharged and go home to their families healthy, then there is a risk that they could contract a hospital-acquired infection from another patient, from a medical device, from a dirty item, a non-sterile item, an unclean item. Okay? So there's three methods. You can clean equipment, you can disinfect equipment, and you can sterilize it. The H.E.R verified technician focuses on sterilizing vectors of transmission. That includes IV pumps, SCD pumps, PCA, patient-controlled anesthesia pumps, feeding pumps, some of the most commonly used devices. There are other companies out there that focus on the common devices as well. Okay? Our methods are going to be 10 times more effective than current methods. I can assure you of that. Okay. The next thing that we're going to talk about is the first initial meeting between the technician and the patient. Once the patient is introduced to the technician. The technician is introduced into the patient, just as with the nurse and just as with the doctor. We're going to have our patients fill out the identification card, just kind of like you saw earlier, as technicians carry with them. We're going to have them fill out the identification card, okay, where they can provide their spouse's information, their family's information, as it pertains to the county, the environment, the situation that they're in currently. For example, if you're an out-of-state student from college, you go to Florida State, and you're originally from Houston. So if you're in a Florida hospital, your emergency contact, may not be your family in Houston at that time. If you get rushed to the hospital, they can't drive all the way to Florida. What does it take, 22 hours? Okay? So, and they may not have money to fly. We can't assume that. So we're going to give them a chance to put their emergency contact, whoever it is. Maybe it may be their dorm mate. It may be someone at the school, an advisor, whoever is their go-to person in case of an emergency for that present time. So we want to have that contact information. We can't rely on the EMR from the last visit because things change. People get divorced. People, move on. People move out. Leases end every 12 months, usually. Okay? Emergency contact information changes. People get new jobs. People relocate. There's all types of situations. We must get that information. That is the initial point of contact. Now, this is where we gain their trust and let them know that we're here to help, despite our sleek, professional, Constitution-based uniform that we're wearing. Okay? When we return, we're going to return this card to them. Okay? And I'm holding two things in my hand right now. I'm going to get to the second one. But we're going to return it with the most important numbers in their area. Okay? Just as I carry around on my badge, the most important areas in, Dallas County or Collin County or whatever other counties are surrounding areas, whichever county I'm in that hospital, those surrounding areas, those phone numbers that I may need with me, I'm going to give it to the patient for the county, for the hospital that they're in, okay? So if you're in a Collin County hospital, then you're going to receive all of the assistance numbers that you could possibly happen to come across in the case of an emergency where you need to get to a phone and just make a call and get help instantly. It may not be a 911 call. Sometimes 911 has been abused in the past, okay? I'm not going to pinpoint specific individuals that were, pinpointed on the news, but sometimes there's a misuse of 911. We want to keep we're in hospitals. We're talking about healthcare here, so we need to also think about 911. We don't want to just be telling patients about hospital-acquired infections and all this stuff, and then they just call it 911. I think I got a hospital-acquired infection. No, that's not what we're going to do. So that's why we're providing them with the appropriate resources. Okay? The next thing is they're going to have the ability to fill out a request card, okay? The technicians are going to take requests, whether it be through a phone call, through a text message, or a note card. They'll have the opportunity, don't have to, it's not mandatory, to fill out like you would get a frequent flyer miles, or you frequent a restaurant and they stamp your card every time you come in. You go to a particular restaurant and that waiter knows you and knows what you like every single time, the way you like it, and it comes out perfect just like you like it every single time. That's why it's your favorite restaurant. You may go there every Friday for the past 5 years. Okay? I used to work at a restaurant called True Lux. There was a guy who was presented a token because he came in so much. He always got his particular item for free because he came in almost every other day religiously. The guy drove a Lamborghini, okay? Very pleasant gentleman. So, it's okay to frequent things. And we don't want to make patients feel like they can't frequent the hospital. Drug-seeking behavior and things like that, we're going to deal with that in other ways by doing mandatory HIV tests, by doing finger pricks, testing for, checking for HIV and things like that, and checking for amphetamines and high drug volumes in people. We may not disclose the full nature of it. It may be a case-by-case scenario, but maybe doing random drug tests. So we're going to reduce that Medicare and Medicaid abuse and fraud with the finger pricks for the micro blood samples with these lancets here. Okay? Micro blood sampling. We'll be doing a little bit of drug testing, and also with the Orquix, checking for HIV whenever you come and get admitted. For sure, if you're admitted into the hospital, because we'll have time to give you results. If you're just coming in to see the nurse practitioner or the PA, physician's assistant, or it's just something like super quick, okay, or maybe you just walked in on accident, no, we're not going to give you an HIV test and finger prick you, okay? And it'll be available for visitors too, okay? If they want to get tested, they can go on ahead and sign up and get tested. It'll be kind of incorporating like an HIV clinic right on into the hospital, because we've got to stop the spread of that, and it's killing people, and it's incurable, okay? It's taking innocent lives, and it's even passed on during birth from the mother to the child, so a child can even be born with that, you know, and it's just something that we can control. Remember, I'm all about improvement, I'm all about doing better, and I'm all about collaborative efforts. Nobody can do everything by themselves alone. You must work as a team, okay? So that's the purpose of these lancets here. Of course, I've got notes for my technicians. If it's an infant, if it is an adult, the proper way to do a finger prick. And they'll have those resources. I'll show you those later. It's just like a page each. Just as a reminder to make sure they're always following the protocol. Of course, using the alcohol swabs and things like that to prevent hospital and healthcare associated infections. So back to what I was saying, the patient in the room, we don't want to scare them too much, so they'll have the comment request cards where the patient is available to make a request to the Ever-Verify technician in writing and put it on file, so the next time they come to visit, they can say, oh, mine's on file. What I like is on file. They don't have to go through and explain every single little detail of what the child needs, what the father needs, what the son needs. They may come in all the time. You know, if you have something like diabetes and you go in DKA often, you know, that's a situation where you may frequent the hospital and, well, you don't want to have a different technician, you know, having to just repeat yourself over and over and over and over and over. That can become agitating. We don't want our technicians to be agitating the patients. We're trying to make their state better. So they have the option of putting a card on file. It'll be put in an electronic database. It'll be kept in a locked file safe cabinet. It does not have any PHI on it, which is like first name, last name, date of birth. All it'll have is the patient number and I'll just have the patient room number with an identifier and the patient's unique identifier. Okay? So, yes, the hospital gives them a band with a barcode. The comment card will have a unique patient identifier. So we will identify them by their patient ID. So, for example, with medical schools, you get a AAMC, okay, ID. That's your identifier, okay? That's not your social security number. It's different, okay? So this will not be HIPAA. It will not have the potential for HIPAA. And I'm even thinking about putting little sensors on the back to make sure they don't leave the hospital. I'm not really sure how we would implement that, but it's going to be some type of, you know, has some type of electronic tracking on it, because I don't want these things getting lost, and we shouldn't be having to, you know, keep, you know, refilling it. So it'll be like a Rolodex. They've even got electronic business cards now. So, you know, there's all kind of technology out there. But that's something to think about. But some type of way, this can't leave a certain range. It's going to stay within a select group of people, which is the Ever-Verify technicians. It's not all around the hospital. It's not going to be at the food center. It's not going to be at the flower shop. It's going to be based on our technicians. The whole point of the Ever-Verify technician is to build a relationship with the patient, okay? So those are the two cards. It'll be similar to being kept in a Rolodex format, okay? So it'll have the alphabet. You can find it based on the unique identifier if you know what the, you know, particular alphanumeric character starts with, you can search by that. It's not going to be searched by last name and first name. It's going to be searched by an alphanumeric identifier that is solely related to the client database. Okay? The other thing is, when our patients leave the hospital, we want them to leave educated. Okay? So we will be providing them, in the nicest way, information on H.E.R Verify mission, goals, and values, okay? And those are derived from the mission, goals, and values of our government agencies who do an excellent job of protecting this nation to date, okay? And I'm sure they're going to do an even more fabulous job in the future, okay? They work very hard. I've seen the documents they put together, the research that they do, the essays, the articles. I mean, there's so many resources out there, you really just got to read, okay? So, but everybody doesn't have time for, to read or have time for, researching all the time. So, I think it's the duty of those who do have time for that and have the intellect and the capability and the comprehension level to inform others. Just like you want to inspire other people, you want to motivate other people, we should also inform other people of things when they come in contact with that particular environment, okay? If Jehovah's Witness and homeless people can stand on the side of the road and pass out things and sell water bottles, sell M&Ms, ask for money, ask for change, ask for donations for churches, and then we should be able to, as technicians, know that we want to inform our patients in the nicest way and most non-scary, I would say, like to reduce public scare, way that hospitals are clean, that our hospital, the hospital they're at, is clean, and they don't have to worry about getting a hospital infection. And if they do, what to do, okay? So that'll all be in the H.E.R Verify information guide that they can get as they leave. It can be in electronic format if they have access to email. We can provide it paper copy, okay? We can also provide it in an electronic media format. Many people come in with their laptops. They're going to come in with their tablets, iPads, iPhones. The Surface 2 from Microsoft has the USB port now, so we can even do it through flash drives. Flash drives are going for almost $3, $5. It really doesn't cost very much for a flash drive, okay? And like I said, I have not figured out how we're actually going to charge the patients specifically. I have an idea on those things, but they're not 100% developed yet, so I don't want to present that. But there will be costs associated with this, but it'll be in a balanced way, where it's balanced for the customer and balanced for the company, okay? So we're not trying to gouge anyone. I don't know if you've ever been somewhere and you feel like you got took. You feel like they took you for everything you had. You told them you were living on Social Security benefits, and they still try to take every single dime out of your pocket, okay? Really? Okay? That's not what we're about, okay? I'm speaking from personal experience. I've been through a lot in life. I'm not going to go into the details of it. I've been through a lot. And what I learned from that is to turn the things that bother me into motivation to find ways to solve it and ensure that it doesn't happen to someone else, okay? Because I don't wish the bad things that have happened to me upon others. I hope that people do have good lives, longevity, free from, getting gouged, free from being misinformed, mistreated, and things like that. That's what I'm all about. This is a startup company that I launched pretty much by myself, but I give all the credit to the supportive people in my life and to the government resources. My college education did a great number on me, gave me a lot of information. I incorporated that too. But it's something about the information that the EPA, the FDA, and other organizations who put together that really inspires and shows a lot of dedication and effort and has a lot of insight, and it's so patriotic. It's so civilian-like. It's so like, it's almost like it goes unnoticed. Like, it's just like they make all these contributions, you know, and, you know, you don't even really know who they are. So, you know, I really admire these websites with this information, which can be used to better healthcare. Okay? So, they can get the H.E.R information guide. This goes on preventing hospital-acquired infections, talks about hospital-acquired infections, communicable diseases, pathogens, and chemical agents. Every time I talk about a problem, I always provide a solution, okay? And I also give credit to the government agencies that I research to put this information together, okay? The next thing is, and everything we hand to them, especially in an airborne room or droplet precaution where they can sneeze on, I mean, it's for theirs to keep. We're not going to make these so expensive to where we have to take it back from them and sterilize tablets, or I'm sorry, sterilize spiral-bound notebooks. Once we give that to them, it'll be given to them. And it can be more concise, maybe in a brochure format. I really do like the spiral-bound method. I think it looks very professional. That's my opinion. So I hope once we get up and running in hospitals that we will implement the spiral-bound method. They will be provided in H.E.R-verified products and services. When you go to a restaurant, you're given a menu. They take the menu back from you, but you don't have pneumonia. You don't have Staphylococcus aureus. You don't have MRSA. Okay, you don't have anything that can be transmissible from person to person. You don't have Ebola. You're not on isolation, universal precautions. So that's why they can take the menu back. Okay? This is similar to a menu because they can order products and services that they will utilize in their hospital stay to improve the quality of their stay, such as the slip-free shoes for the elderly. Okay? You can order these items and take this home with them. So even if they want to bring it back the next time they come, put it in their hospital to go bag for the next time they come because they're prepared, then that's perfectly fine. Okay? So I'm not going to pull the exact presentation up. I'm just going to show you how easily readable it is. It's not full of words to where you read it and you get overwhelmed, okay? And it'll have the price and things of that nature. So this is the Shoes for Crews Ollie, which, like I said, lots of the things that we're going to offer will be unisex or child-specific, okay? For example, with the Easy Bake Oven, there was a complaint made that it was geared toward only girls when guys want to learn how to cook too. So that's why I think the unisex items are a great way to go. So that's just one thing I want to touch on. There's several things they can order and several partnerships that are integrated in here that I would like to act on, especially with smart ones as far as preparing pre-TV dinners or pre-cooked meals where you just heat it in the microwave or, you know, heat the pre-cooked meal and it's already tailored to fit a diabetic patient or a patient with high blood pressure. You don't have to look on the back and try to look at the sodium content, try to look at the sugar content, and figure out whether or not they can eat it. If we can partnership with Weight Watchers, with Smart Ones, to get some diabetic Smart Ones and some hyperlipidemia, high blood pressure monitoring Smart Ones out there, where they just heat it up and they just go, especially for elderly patients who can't maybe cook anymore. They don't want to accidentally set the house on fire. You may have a young child with diabetes who can't cook. So I think that initiative would be great. So this H.E.R verified products and services is geared toward those type of things. But like I said, this company is being built from the ground up. These videos are being made to communicate the ideas and the morale and the explanation behind the materials that I'm getting ready to work toward implementing in society. Okay? I'll be open with you. It's August 14th. It's 2014. I am 26 years old. A lot of people don't like to reveal their age. I'll tell you right now, I'm 26 years old, and I'm going to make it my mission to get this company up and running because I think it's going to do healthcare and society some good. And I'm not on this video, but on a prior video, I have a video where I show the mother-to-be scrubs to prevent cold pinks from occurring. I just want to let you know in this booklet, it emphasizes the importance of protecting your infant when you're in the hospital. So it offers the on-the-go bags for infant care, kids, movies, and mother-to-be on-the-go bags. Remember, we're not going to focus on toys, things that can be coughed on or bled on, or vomited on, or anything like that, because we are in a healthcare environment and we do have to be very cautious and take precautions. So putting a disc or DVD, you can clean a DVD with isopropyl 70% alcohol and it'd be okay. Okay? So that's the way we're thinking, okay? We're just thinking smart. It's not that I'm inventing the DVD. I went to Walmart, I saw kids' movies, and I saw it in a 10-pack, a kids' movie 10-pack. So that child's probably going to sit there all night because they can't sleep because mommy's in the hospital or daddy's sick, daddy's in the hospital. They don't know what's going on. They may not even have a diagnosis yet. They don't know what it is. So they're just sitting in there waiting. It's summertime. The kid has nowhere else to go. But no, they can't afford daycare. You don't even know the situations that go on in life for people, you know. So, I mean, this child has to sit there all day. Why not give them a 10 kids movie pack that the parents can order and they just watch 10 movies in a row and just relax and kick back with mom. Mom press pause, and when mom is tired of and ready to go to sleep, or dad's tired and ready to go to sleep, they can put earplugs in their ear. Okay? We all know what earplugs look like. They come in all little different colors. So I have some earplugs, but you know what earplugs look like. So they can put those in and still get that rest and just cut the TV volume at a low volume. You know, if you want to know what a low volume is, just don't go past your age. Okay? The next thing that we'll be offering our guests, and they get to pick and choose. Like I said, there's places you can go and they have a whole wall full of pamphlets and brochures, and they use all kind of ink and paper to print those things. Sometimes people take them, sometimes people don't. Sometimes you hand stuff out and people just throw it right there in the trash or throw it on the ground. You can go get business cards and hand them out. People will throw them on the ground. So I don't think there's anything wrong with having a company that makes spiral-bound notebooks, you know, being mindful of ink and, you know, budgeting, maybe using recycled paper and things like that, and giving those to patients as they get ready to leave. One thing we want to teach them, and I was inspired by a government agency as far as what works, and I think it's clinical effectiveness. Okay? I spent some time working for a corporate healthcare company that did lifestyle and disease management programs, and what I noticed was that a lot of patients really didn't know what they were diagnosed with and didn't know the medical definition for it. So, prime example, you ask the patient, have you had any heart problems or heart failure? Well, I had a stent put in. You know, you say, have you had any stress issues, or have you ever had a stroke? You know, and they really just know vague things, like I had a stent put in. They may not even know how many times, okay? They don't know how many bypasses they had. So there are several things, you know, several things that they don't know, and there's a lot of terminology they don't know. So I think bridging the gap between medical literacy, patient knowledge, and physician medical jargon knowledge. Okay, and that's what works clinical effectiveness is about. And it gives examples and commentary and the appropriate way to answer. And I also ask for feedback. So patients can contact me. The other thing is, we want to have a couple. You can go to the gas station and pick up a BC powder, and you can also go to Kroger's here and pick up glucose tablets. If there's a patient that comes in with a toothache and they may be allergic to certain medications like sulfur drugs, or they may have already taken a high dose of something and they just need something mild for temporary relief, and they may not need a high milligram dosage, or they may not need it intravenous, and they really just kind of need like instant relief. I think it's perfectly fine for technicians to offer BC powders. Maybe the dad or visitor or family member's tooth is hurting, but they're trying to stay there with their family, having some aspirin on hold. So that way we don't have patients saying something hurts or asking for a pill, but then giving it to a family member that's visiting or a visitor that's visiting, just because the nurse is there to give medications. Okay, so that's not funny, but I'm thinking in terms of people trying to help someone, but it not being legally correct, or the best thing to do, or morally correct, or ethically correct. It may not be within the law. So if somebody's having pain and they need some instant relief, BC powder works pretty good. As long as you're not allergic to it, we can offer these and sell these for family members or even the patient. Okay, if the medications are making them vomit or throw up, or it's too strong, or their body can't handle it, or they've already got enough IVs going, a little aspirin can knock out some of that pain, especially if it's just something minor like a toothache, maybe even a fever, okay? If you want to just try to lower the dosage. Glucose tablets. Someone with diabetes may be visiting one of the patients, and they came over in a rush, they came in a hurry, didn't have time to grab their glucose tablets. These raise low blood sugar fast and boost energy, okay? So these are what diabetic patients take whenever their blood sugar is too low from taking the insulin, okay? Which is what a physician told me, explained to me. And they take the insulin, but sometimes the blood sugar goes too low, so they can take one of these glucose tablets and it'll spruce it back up. We want to try to keep the loved ones at the bedside of the patient. The patient usually wants someone there to comfort them and to be there for them, especially if you don't know what the end result may be. And the last thing that I would wish on a patient, or hope that would happen to a patient, like I hope this would never happen to them, is that they leave for a split second. It's just kind of like with a child. You turn your back for a split second at the pool and the child has drowned, okay? You leave for a split second, maybe to go to a restaurant to pick up their favorite meal, maybe to go get something to entertain the kids, maybe because you have to be to work or work a shift and you couldn't get off. But we want to try to keep them at the side of their loved one unless they just have to leave, but not to just go get a glucose tablet, not to just go get an aspirin, not to just have to go to the restaurant to grab something for them to eat. We want to try to accommodate them as much as possible. And that's why I really want to offer these services. When I say hospitality and healthcare, you go to restaurants, you go to hotels, you get all this service. But why don't you get that service when you need it most? When you're weak, when you can't walk, when you're bent over, when you're slumped over, like when you're really going through it, And like I said, we want to be cost effective. We want to make things affordable for patients, but availability is key. So even though we may be charging for some of these items, you have to realize if you're in a rural area and Walmart is 100 miles away or 95 miles away, what are you going to do? Okay? You could be gone for hours. So having this available at a, not like a 600% markup like some places, but just having it a reasonable cost and a reasonable price available for them, aside from the gift shop, having to go all the way downstairs and having to do this and get lost, and you're still away from the loved one's side, we're coming to the room and delivering these things. You don't have to leave their side. This could be the last few hours that this person is alive, okay, that this loved one is alive. And we don't want you to say and beat yourself up every day for the rest of your life. You're at work, about to quit your job because you just lost someone you love, and you were mad at yourself because you left the hospital to go grab something from Walmart or from the local superstore or from the restaurant, okay? Because they can only eat a specific type of salad or something like that with a specific type of dressing. We want to bring some of these items to the room, okay? One thing that we're going to be teaching patients, like I said, simple things. You have these latex gloves, but we also use nitrile gloves. A lot of people have a latex allergy, whether they know it or they don't know it. A lot of people are allergic to latex. So we want to make sure that patients are made aware that these are latex gloves. This country has already taken initiative. You've got gauze pads that are latex-free. You've got latex gloves, okay? So there needs to kind of be a decision made in the patient's mind and in the technician's mind and in the nurse's mind. Do we want to have latex in the room or do we not want to have latex in the room? So is there a latex allergy or is there not a latex allergy? And I know there are bracelets for that. So just making sure the patient doesn't accidentally make the mistake and say, oh, well, I had a staph infection and I've got a hole in my leg and I've got to patch that up with the H.E.R. Iodoform packing strip when I get home. I've got to wrap it up. I've got to bandage it. I've got to tape it up with the tape. I've also got to use the benzoin on it. So that's a lot to think. I also have some swelling, so I got to remember to put this in the freezer, let it get frozen, or I've got to get a hot pack and heat it up in the microwave. Which one did he tell me to do, heat or cold or ice or warm, elevate? There's so many things to remember when you get discharged from the hospital. That's why, remember, they've got the notepad so they can take down notes. So, in the midst of all that, they could not be aware that they have a latex allergy, pick up these latex gloves on accident, bring them home, okay? Not even realize that all the stuff that the doctor gave them says latex-free, okay? So people will grab gloves because gloves are like free in the hospital. They're kind of like hand sanitizer. That's kind of free. It's a precaution. If you're going to touch something or pick up something off the floor, I don't think hospitals mind if you put on a glove. So these are kind of like available, and we just want to make sure that patients and family know the difference between latex and nitrile. I know that healthcare professionals know that. I don't have one doubt in my mind that there's not one person in the hospital that's working that doesn't know the difference between latex and nitrile. That's not what this is about. This is specifically about the patient, maybe just coming off of anesthesia, maybe with an altered mental status. Maybe they just don't know, okay? The difference between latex and nitrile. When there could be a potential allergy, there could be a child in the room with an allergy. We just want to try to emphasize that a little bit more, because I know it's an issue because they're making a lot of latex-free products, so there must be a lot of people with a latex allergy. I'm not sure about the statistics on that. I'm sure that the research has been done, that number is out there, but generally speaking, those are it's the little things that count sometimes. Sometimes it's that extra step. Sometimes it's thinking for that person because they didn't think of it at that time, okay? So, also, one thing that will be free, because we will be charging for these items, my theory is, if you go to CVS, to Walgreens, to Walmart, to Sam's Club, to any pharmacy, the neighborhood pharmacy, wherever you go. You spend your gas to go to the pharmacy. You spend money to buy your prescriptions and pay your co-pays. You spend money to your insurance to pay your deductibles and things like that. People are spending money, okay? But what we want to do is make things affordable, okay? Make them available at a time of need. Make them convenient. We, as H.E.R verified technicians, want to take the initiative and anticipate the patient's needs, okay? This is about anticipating the patient's need, okay? It's not uncommon for people to have $20 on them. It's not uncommon for them to have $100 on them. One thing that people love to do when they go to the ballpark is buy hot dogs, nachos. When you go to a theme park, you want to get soda, cotton candy, turkey legs, and the markup on those items is very high. We're not even going to do high markups on these items. We're just going to make them available and make them affordable, okay? And include gratuity for the service that they're receiving. And it will be excellent service. It will be mandatory 18% gratuity. However, the service will be impeccable, okay? Remember, they're wearing this uniform with dignity, honor, and pride. They're representing this Constitution. They're representing the United States of America in the 2014 year, okay? So, like I said, as improvement happens, things get more competitive. Competition is out there. You've got Apple, you've got Samsung. You know, who you with? You've got to be competitive. You've got to be impeccable. You've got to have impeccable service. You've got to go above and beyond. You've got to be more than available. You've got to be more than willing. You've got to be willing to work harder. You've got to be willing to be smarter, okay? And this is what this is about. Being there for someone that can't be there for themselves at that present time. It doesn't mean they're weak. It doesn't mean that they're not worth anything. We just want to be that extra leg for them, okay? So every time we visit, we're going to give them these free little roses, okay? And they'll get a different color each time. So what I would do as an H.E.R verified technician, I would knock on the door, ask to enter the room, identify myself, verify the patient that I'm delivering whatever item to, verify the HIPAA identifiers, depending on what it is and who it's being delivered to. And because I entered the room, regardless of who is receiving the item, if it's a visitor or the patient, I will be leaving a little bag on the first visit. And I picked a white rose. So they'll have this sitting at their bedside to remind them when they look over there, oh yeah, the H.E.R verified technicians. I don't have to keep coming by the room over and over and over and over and over saying, do you need anything? 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 I will have my rose in there in my little bag, and they'll remember that I was there, that I brought them this, okay? They'll also have my business card that I provide to them on the first introduction with my cell number, direct work hospital cell number, where I know I get service, I know the network is good, I know the call's going to go through, okay, where they can call me on. They can even call me from the hospital phone on my cell phone that's in network in that hospital, okay? So whichever hospital or healthcare facility you're in, whatever network tower is there, that's the provider that we're going to go with, so to guarantee that you have the 5 bars, okay? So every time I come visit, I'm going to put a new rose in here. So I go, ta-ta, hello, hi, my name's Alexandra. I am an H.E.R verified technician. and they can see my badge and my certifications and everything. I'm introducing myself. I want to let you know I'm here for any resources. Can you fill out this identification card so we can make sure that we have the best contact information updated for where you are right now in your life. And also, when you give that to me, I'm going to go ahead and upload it in the database so the doctor and nurse don't have to worry about it. They already have 50 million things to do. And I'm not going to say that, but that's a side note. And I'm going to bring it back to you with all the important numbers, you know, hotels, emergency, EMS, fire department, you know, any number that you may need while you're, you know, getting ready to be discharged from the hospital. Okay? So I'm going to bring that back to you so you can have all that. Also, I'm going to drop off this pamphlet here with the products and services that we offer. If you need anything during your hospital stay that we offer, I would be more than happy to bring it to you within a specified time frame. We do go on a priority service, so based on priority, you know, that determines the delivery time. However, it will not be more than 24 hours for your delivery unless we have an extenuating or uncontrollable circumstances such as the item is not available. Okay? But we typically keep everything in stock, and we do a good job at that, so you shouldn't have to worry about that. And every time I stop by your office, or I'm sorry, every time I stop by your room, we're going to put a little rose in here just to remind you that we've been here. So you can keep track of how many times we've come to visit your room, so you are always comfortable with who's entering your room. I know your personal belongings and things are in here, so this is how we kind of make our presence known and help you keep track of our visits, okay? And that'll be that. For cash-paying customers, on the tablet, we will have a device where they can swipe their debit card, Visa, MasterCard, Discover, American Express, prepaid card, whatever they want to use, okay? That's accepted in this country as the common acceptable standard for methods of payment, along with cash, including the auto 18% gratuity for the items that they are purchasing. That is one method of payment. Okay? I don't want to discriminate against people who cannot afford to get these services. So, we're going to try to come up with some type of bill me later form, such as like eBay and Amazon and things like that, where they can be billed later, or some type of credit. A lot of times people receive large hospital bills in the mail. They do not pay them. Okay? Sometimes people receive IRS, you know, demanding money, thousands and thousands of dollars. They can't pay them. People do not have thousands and thousands of dollars laying around. That's why everything that we offer is going to be a necessity or a want or convenient for them and affordable, and it can be paid in a reliable format and transaction. Okay? So, we'll be dropping these little free roses every time we come visit. So, that's how we keep track. And they get a different color every time. I think this is an excellent idea. You know, people usually get, like I said, those little cards and they just kind of stamp it. It may be in the shape of a star. These are just little baggies with a little